My name is Christine Vogel, and I'm a nurse educator at UbiSim, and we're dedicated to nursing and nursing education. So we do have a best-in-class immersive VR scenarios, and you can see that our friend Dan is in one of our scenarios right now. There's natural, intuitive interactions here, and he's got the MetaQuest 3 headset on, and it's compatible with the MetaQuest 2, 3, and Pro. So while he's in here caring for the patient, he's in the PPE room right now. What's really nice is that there's no menu-based communication, so he can just talk to the patient and it's facilitated. The patient will talk back and have that authentic communication with him. And then also he can use the handset as well, and he can just pick up stethoscopes and tools. Again, no menu-based communication, no menus here. So whatever the nurse wants to do in VR, they just go ahead and pick up that stethoscope, and they can go ahead and listen to the patient, auscultating the heart, lungs, and bowel. They can sit the patient up. They can go ahead and look through the EHR. There's a medication administration record. They can go ahead and give medications, do procedures, draw labs, get results, communicate with the patient, communicate with the family member, and they can also call on the phone as well. So if there's a provider that they need to communicate with, they can call on the phone. And you can also program that. It can be anyone from the interprofessional team as well. Facilitation is really flexible as well. So you can have one learner in, so Dan is in there by himself caring for the patient, but you can have up to 3 learners in multiplayer. So 3 learners can care for the patient. One can be talking to the patient and assessing, one can be looking through the EHR, one can be talking with the family member as well. Facilitation is really flexible with UbiSim as well. So a faculty can facilitate UbiSim scenarios, but then also it can be used in a peer-to-peer facilitation mode. This is really important to scale up your simulation program. So our scenarios unfold according to what the learner does and does not do in the scenario. So it's a standardized experience. So even a peer can facilitate and trigger those dialogues. So it really scales simulation as well. All of our scenarios are a complete simulation experience, from the pre-brief to the simulation to the debrief. We follow the IMSH standards of best practice, and all of our simulations are created by expert nurse educators, and they all align with the AACN Essentials domains and the Next Generation NCLEX and the Clinical Judgment Measurement Model. So next I'm going to hand it off to our nurse educator, Marissa, and she's going to talk more about scenario design and scenarios within UbiSim.
Hi, my name is Marissa Kloss. I'm a nurse educator with UbiSim, and we want to show you the catalog today of all of our scenarios that we have to offer here at UbiSim. So in our catalog, you can see that we have various learner levels. We have tutorials, we have fundamentals, med-surg, pediatrics, so it's really across the lifespan. We also have OB scenarios as well. And so we really have a huge depth of content with this, various learner levels and different types of avatars, so that the learners can really interact with different types of patients and ages. We also have different options to customize the scenarios that we have in the by UbiSim category. So you can use an already existing scenario for the learners, or you can change the learning objectives and customize it to your own needs. Additionally, we have a by the community, where our partner programs will create scenarios, and then they can use those scenarios to share with other partner programs to have, again, a depth of content available to our end users. All of our UbiSim scenarios are reviewed annually to make sure that they meet evidence-based practice standards, and we create all of our scenarios based on IMSH standards as well. So thank you for joining us at our UbiSim booth, and check us out at ubisimvr.com.